Dr. Javadi reassured me that his choices for my treatment were strategic and predictable. He had high expectations. I was quite intrigued because he told me that there was a good chance that after the first chemo treatment, my lung would pop back into place. He told me that I probably wouldn't lose any hair and go through a lot of the side effects that a lot of people typically go through who have cancers, especially stage 4 cancer. And sure enough, right after that first treatment, I felt my breathing getting better, and that was kind of like some kind of miracle as far as I was concerned. And you know, we did the tests, and apparently my lung popped back into place, and the tumor in my lung was gone, and the fluid that was on my heart started to subside, and then that disappeared. And every single treatment after that, I became better and better. So I'm grateful, very, very thankful for Dr. Javadi and his staff.
It's a tough situation. You need to be somewhere where you feel comfortable. So I think in this situation, comfort is the main reason, physically and emotionally. You need someone to listen to you and answer all your questions. I've been to other places that I didn't like, that the doctor comes in and they rush you, they don't pay attention, they don't want to spend much time with you. I even was told once that when you come and see the doctor, make sure you write down your questions so you won't be wasting doctor's time. But when I came here and I met Dr. Javadi, the man was so nice and spending all the time in the world with you. And I mean, I was like, this is the place where I want to be treated. And when in a situation you're sick, you're dealing with serious illness, you need someone to respond. It's not like you leave a message and they call you back 3 days later. No, this place is like, they're quick, right away, and the top. I mean, I hear different stories from different people. I mean, this is 10 out of 10 if you compare it to other places, you know. It's something serious. It's your health. I mean, at the end of the day, it's your body. This is not like it's your manager you're dealing with. You're going to quit. You're going to fire you. No, I mean, this is a place where it's your health. You know, if you fail, you die. So this is a serious situation. You want to be with serious people.
When you are diagnosed with something that you don't know and you have absolutely no idea what's going on, a lot goes to your head, and there are a lot of questions that you have. When I met with Dr. Javadi, he was extremely present, very pleasant, explained all the questions and all the answers that I was looking to get from him. He told me what's going on, the course of my treatment, and what we need to do. And basically, he answered all my questions, and there was nothing left in my mind that I did not know what I need to do and what needs to be done. Before I leave Dr. Javadi's office, I made up my mind that this is a doctor that I want to work with because I felt very comfortable and very confident. And I told him that I want to start my treatment right away. After talking to Dr. Javadi, we started my treatment, the first round, about 2 weeks later, because I had this cancer that has been spreaded into my lung, as well as my lymph nodes. So we need to concentrate on that and start the treatment. The first round of my treatment was more concentrated toward my lung. And after the first round, we had a PET scan. It's normally the test that is done after the end of your treatment to see how successful the treatment has been and to see the result. The first PET scan that we had, the result was extremely successful. I could not believe it. I could have not been happier. The cancer cells in my lungs, they were gone. And we did not need to be worried about that anymore. That was something that I could not believe that in one treatment that I had, and with the concentration that Dr. Javadi has put to do this treatment for me, we were able to get rid of that. But the PET scan also showed that my lymph nodes were still not completely out of the cancer cell, and we needed to concentrate on that. After we spoke to Dr. Javadi, and we had another course of treatment for the lymph nodes, and we started my treatment. At the end of the treatment, We had another PET scan, and it was another success. It was something that I could really maybe dream about it, that going through the treatment and the treatment to be so successful and bringing me all this good news, it was just like unbelievable, and also for my family. And the results showed that my lymph nodes has been shrunk by 70%, and they were in much, much smaller size. And all we needed to do right now was to concentrate on the other 30%. That to me was that we were on the right road. We are doing what needs to be done. Dr. Javadi concentrating on the type of the treatment that I need to have, all the research that he did to come up with a treatment that is customized for specifically targeting the cancer cell that I have. Something that I always mention is not one size fits all. With Dr. Javadi, he always customized the chemo for what you need and what needs to be done. And that's why we have been very successful. I cannot be happier about this decision that I made. I honestly do not think that if I would have not come here, I had any chance of survivor. The fact that it's so delicate, the fact that it has to be just for you, the fact that it has to be targeted for you, it has to be basically a study for you, that by itself put me in a very, very successful road here. And I don't think if I would have not come here, I would have never been able to have this recovery that I have now.
Even I work in the hospital, I work in the critical care. I don't deal with oncology until my mom gets sick. And then I start asking around, who is the good oncologist. Dr. Javadi has very good reputation in the hospital. Also, her primary care doctor referred Dr. Javadi. So I had other doctors look into this situation. All of them recommended that's it. Give her 6 months to live without treatment. Just let her be happy. That's why I was prone to that. Try to convince her, let's, just face this. Probably there is no hope. You start chemo, going to suffer. I don't want her to suffer to death. But she wants to try. And 4 years so far, exactly 4 years. And she's still with us, and she's still walkie-talkie. Here is very clear.
If you look at all the chemotherapy that is given every year for cancer patients, when I asked you what percentage of patients that receive chemotherapy get any benefit at all, we're not talking cure, just any benefit of all, it's about 1/4. So we're giving a lot of chemotherapy to patients who don't benefit. But the problem is, we don't know which of those patients are going to benefit, so we have to give the chemotherapy to everybody. And what I like about the work I do with Dr. Javadi is that he's kind of cutting edge, okay? So he does a lot of genetic analysis of a patient's tumors, and then he individualizes the specific treatment regimen based on characteristics of that specific individual's tumor. You may have heard about the Human Genome Project. It was started in the 80s, and now we understand what every gene that a human nucleus has, what it does. And now we're taking that a step further and looking at the genes that are involved in the proliferation of cancer cells. Why do some cancers spread and end up causing an individual to not survive, and why are other tumors don't have those characteristics? Well, the answers to those questions lie in the genetics of the tumor cell. And you can study it and you see what genes are driving that cell. What Dr. Javadi does is he looks at those specific characteristics of the tumor, and then he based on those specific characteristics, he will tailor a specific regimen that will have higher efficacy. So if we could understand the specifics of an individual's tumor, then we could pick drugs that would have a higher chance of working. And so A great example of this is a patient that I've asked Dr. Javadi to treat. Okay, he was actually a childhood friend of mine that grew up across the street from me in Pittsburgh, and about 10 or 11 months ago, he was diagnosed with pancreatic cancer. So Dr. Javadi has been treating my friend Bill Coyle with a combination of immunotherapy, some chemotherapy, some traditional chemotherapy, some chemotherapy that is called anti-angiogenesis, okay, a drug called Avastin. And we've been able to keep my friend cancer-free for the last several months. And, you know, only God knows what will happen. We're not trying to say he's going to be cured, but we are giving him some quality of life.
Everybody has been very cordial to me, asking me if I need anything. My treatment has been anywhere between 5 and 7 hours, sitting in the chair, getting the infusion in my port. And there's always somebody very nice coming over to me asking me if I need anything. Can I get you something to drink, something to eat? And always somebody checking on me every, 10, 15 minutes, which is, it's like gold.
And this is kind of a unique experience for me as a surgical oncologist because, many times you're treating someone you don't know, and you care about them and you can give them empathy and compassion, but it's different when you're taking care of somebody that you grew up with. And Bill and I don't know where this journey is going to lead, okay? But I do know that he's derived a lot of benefit from this specific approach, this precision medicine.
Yes.
And I'm happy to be able to refer my patients for this type of care.
My emotions are pretty much the same. I have all the confidence in the world in both my friend Dr. Lomas and Dr. Javadi that, things are going to come out very positive in the end.
My own doctor introduced me to Dr. Javadi, my family doctor. Said he's one of the best doctors for the cancer. So I came in and I've been treated by Dr. Javadi's and the group, which I've been treated fantastically, fantabulous, and I appreciated that. But I still feel strong and young, and I don't feel I'm weak at all.
It doesn't feel like a facility, it feels like a home. It's like family. So it makes it easy for your chemo, especially with the side effects and everything that goes in through your body. They make you feel positive and they listen to you.
I was diagnosed for ovarian cancer on beginning of 2016. In 2.5 years, I was on treatment, chemotherapy treatment, non-stop. And finally, last July, 11 months ago, I was told, this is it, they cannot do anything else for me, and I have 6 to 9 months to live. So I came here and met Dr. Javadi, and he started treatment, and I'm here now. And day by day, I'm getting better. I should be gone, but still I'm here, I'm doing good, and cannot be better than that. I cannot believe it because it's like a miracle to me. I was ready to go. I gave up. But Dr. Javadi was helping me to back to life and enjoy with my family.
About 5 years ago, I was diagnosed with colorectal cancer. And lucky for me, it wasn't a very high stage. It was between stage 0 and stage 1, so it was caught pretty early. I had a regimen of chemotherapy and radiation at the time. And I was being cared by a different oncologist, as well as a colorectal surgeon and a radiation oncologist. They told me my cancer was 95% curable. I followed all the regimens, what they told me to do, and at the end of the treatment, the colorectal surgeon told me that I was cured. A few years later, sure enough, there was a tumor, pretty good sized one, in the same area. So the cancer actually had come back. That was a major turning point in my life because I was so sure that I was going to be the 95% that would be cured. But there's got to be 5% that isn't, and I was one of them. I didn't know where to turn. I didn't know what to do. My colorectal surgeon brought me and my husband and my mother into his office and basically said, the only way we can get rid of this is you're going to have a major surgery and you'll have to wear a colostomy bag for the rest of your life. I refused. Not because I'm vain, I just felt that there was something else that could be done. So obviously I started researching my options. I don't even remember how I got to Dr. Javadi. I think it was through my insurance that they had told me, go and see this doctor. And I was totally against it. I actually wanted to go to the big guys, UCLA. I wanted to go to cancer specialty. But I did come with the hopes that this doctor Dr. Javadi would actually send me and say, no, this isn't something I can do. I'll send you to even more of a specialist. Well, lo and behold, I came. He totally researched my situation. No guarantees, but he said, I'm going to try something out of the box. And it's up to you. Do you want to try it or not? Of course, I was ready, willing, and able. I did not want the knife. I didn't want to be disformed for the rest of my life. And I went through the chemotherapy. He put me on an immunotherapy. I changed my diet. The staff here was very uplifting, very accommodating, because when I first got here and started the treatment, I was hysterical. I could not keep, when I think about it, I even want to cry. I couldn't keep a straight face. I was so scared. Because I said, if this doesn't work, I'm going to have to go under the knife. I won't have another option. Because there really wasn't any other. And I kept praying to God that this is going to work. And luckily, with the experience and the know-how and the thinking out of the box, Dr. Javadi and his staff, I did a PET scan last June, and my tumor is gone, where nobody thought that it would be gone. I'm very grateful, very, very grateful. I'm in recession since last June.
We started in March 2018, and I was in a lot of pain. When he started the treatment, a month later, my pain went from 100% to probably almost nothing. There was no pain left. The chemotherapy and the combination with the immuno was working wonders in my pain. So then the tumors were reducing and then disappeared in a matter of 3 months. It is amazing the way I felt in the very, very beginning. I was taking painkillers every 4 hours. And I came to my first treatment and I was just crying because I was in so much pain. And Dr. Javadi said, well, my goal for me is to reduce that pain right now. So we had the first treatment, and it was just, after the first treatment, it was just like a miracle, because my pain went down like to 0. It was just amazing. I couldn't believe it. It was just amazing.